Welcome to this Fisher & Paykel Healthcare presentation on how to fit the Visairo Hospital Under-Nose Mask. The F&P Visairo Under-Nose Mask eliminates nasal bridge pressure while providing an open field of vision. Please note, Fisher & Paykel Visairo masks are single patient use for a maximum of 14 days. Always refer to the user instructions supplied with the product for a full list of instructions, warnings, contraindications, and explanations. Mask options and applications. There are 3 mask options for the Visairo Under-Nose Mask. The Visairo RT075 with a clear elbow is the non-vented anti-asphyxiation valve version. It can be used with a single limb circuit. An exhalation port must be used with this mask. The Visairo RT076 with a blue elbow is the non-vented standard elbow version. It can be used with a dual limb circuit. The Visairo RT077 with an orange elbow is the vented anti-asphyxiation valve version. It can be used with a single limb circuit. As venting is incorporated into this mask, it does not require an exhalation port. Sizing the mask. Before we begin, please note that the instructions in this video apply to all 3 mask types. However, we will demonstrate the steps using the Visairo RT077 vented mask. Remove the Size Me sizing guide, which is sealed separately to the mask. Follow the instructions provided on the guide. Place the sizing guide under your patient's nose and match the patient to one of the colored nasal profiles. Angle the guide upward so that it lays flat against the bottom of their nose. The outline of your patient's nose should fit within the colored nasal profile. Select the mask size based on the colored profile that best matches your patient's nose. This patient is size A. Fitting the mask. Connect the mask to the flow source and ensure patient monitoring is in place. Undo the lower headgear clips. Gently place the mask under your patient's nose and slide the headgear over your patient's head. Connect the headgear clips onto the mask. If the seal is sitting on top of the nose, this is incorrect. Ensure that the floating seal sits comfortably under your patient's nose. Adjust the crown strap to ensure there is approximately a finger's width gap between your patient's ear and the headgear. Also ensure that the straps are not too close to their eyes. Adjust the upper headgear straps to ensure that the floating seal sits comfortably under your patient's nose. Adjust the lower headgear straps so that the seal rests securely on your patient's chin. Avoid over-tightening the mask, as this may lead to discomfort and leak. Gently pull the mask away from your patient's face to allow the seal to inflate. If the patient has an orogastric or nasogastric tube, place it within the integrated tube fit seal zones to achieve a good seal. Do not pass the tube through the nasal opening in the mask. Ensure that the tape is as smooth as possible on your patient's face to help establish a good seal. Removing the mask. To remove the mask, undo the lower clips on both sides of the mask. Gently slide the headgear off your patient's head. By undoing the clips, you should not need to readjust any of the Velcro straps on the headgear. You can keep the upper straps attached to the mask. Refitting the mask. Gently place the seal under your patient's nose. Slide the headgear over their head and reconnect the easy clips. By refitting the mask using just the easy clips, there should be no need to readjust the headgear straps. Gently pull the mask away from your patient's face to allow the seal to inflate. We hope you have enjoyed this presentation on how to fit the Visairo Hospital Under-Nose Mask. The F&P Visairo Under-Nose Mask eliminates nasal bridge pressure while providing an open field of vision. For more information, please contact your local representative about these or any other Fisher & Paykel healthcare products, or visit fphcare.com.